Hello and welcome to all of our Gold Learning viewers. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC for Gold Learning. Well, I have the pleasure of sitting down with Dr. Jessica Tearne today, and she's going to be speaking at our upcoming Gold Perinatal 2017 conference. She is going to be talking about parental age and mental health outcomes in children. What do we know and where to from here? Welcome, Jessica. It's great to have you here today.
Thank you so much for having me. It's a pleasure. I'm really excited about presenting.
Well, as we are too, and I can't wait to hear more about your presentation. However, let's just back up a little bit and have you introduce yourself to our listening audience today. Tell them a little bit about yourself and, of course, what you're doing on your day-to-day life.
So I am a clinical psychologist and a researcher here in Perth, Western Australia at the Telethon Kids Institute. So I started my journey on this pathway back in 2006. I did an undergrad degree in psychology and then entered the postgraduate training program at the University of Western Australia, where I began my clinical training and concurrently completed a PhD. And I was looking at data from the RAIN study, which is a large longitudinal cohort study of Western Australian children. And I'll be presenting on some of that data in my talk. And I was initially really interested in mental health outcomes in children and adolescents, and was looking at the impact of parental age. So in Australia and the United States and around the world, we're seeing a significant trend towards delaying parenthood. So now more people than ever before are having children in their 30s and 40s. And I was very interested in trying to examine the impact of that on mental health outcomes in kids. So what benefits does it convey? Does it have any negatives? And what does that look like? And I started looking at that in the RAIN cohort. And through that, I became really, really interested in maternal mental health and how we best support mothers, particularly mothers of advanced maternal age, and how we can support them in their journey from becoming independent women who often have worked and spend a lot of time developing career and relationships to then transitioning into motherhood at an older age.
This is a very fascinating topic, of course, because there's, of course, this trend in parental age. Are you finding that you're getting a lot of support? Is there a lot of interest in this? Are people just dismissive of it, or do you feel like there's a real momentum and you're off and running with it?
I've had tremendous support, and certainly our research here and the topic more generally has garnered a lot of media attention recently, and there's a lot of discussion about it. It would appear that an older maternal age and this trend is emerging as a significant public health issue. And it's also been expressed to me from talking to midwives, nurses, pediatricians, gynecologists, obstetricians, as a real concern for them. How do we best support these mothers? And do we need to address this trend toward older parenthood? Because there are risks, especially for women and their children, at having babies at an older age.
Yeah, absolutely. And so for you yourself, was it something that you were invited in to do, or was this just something that you gravitated towards? How did you get started with it, Jessica?
I've always been very interested in maternal mental health, and as part of my clinical training, I spent time at our major maternity hospital, and I was also fascinated by child and adolescent development and trying to look at early predictors of mental health in children because I'm passionate about early intervention. So this was the perfect marriage of research and clinical interests for me. And certainly in my clinical and research work now, I still work with women postnatally and running postnatal mental health and lifestyle support programs, which they can bring their babies along to as well, which satisfies me just fine because I love babies. and I get the pleasure of tracking these women from 6 weeks after birth till 1 year postpartum.
Wow. That's incredible.
I'm very, very fortunate to be doing research work in a topic I'm really passionate about and that I love very much.
No, that sounds wonderful. And be able to follow those families and get a bit of a fix, it sounds like, in there, Jessica, too. Sounds like a great way to be doing your work on a day-to-day basis. So
Absolutely.
with this topic, were there many things that surprised you? And I'm not going to keep you too long today, but I just feel like I need to ask you because I know this is a bit of a sneak peek of what's coming up. But with some of
Yeah.
the results, have they been surprising you, Jessica?
I don't know if I'm surprised. We had to do a lot of thinking about because it's such a complex relationship, there are so many social, biological, psychological factors that might underpin the
Totally.
relationships we found in the research we've done, and certainly the breadth of other research out there. And in my talk, I'll be talking both about what we found in the RAIN study and looking at how particularly maternal age influences child and adolescent mental health, and how that relationship isn't necessarily um, consistent across childhood and adolescence, but then also talking about the really novel ways some other researchers have been examining this relationship and trying to partial out different social, biological, and psychological issues in order to better quantify the relationship. So I hope that I can give everyone a bit of education on all the really cool methodological ways we can approach this problem as well.
Totally. Well, it does sound very cool, and I think that this is such a relevant topic needed. I'm still not hearing enough people talking about it, so thank goodness you are here, and we appreciate that you're going to be sharing your study work with us here at Gold. Well, thank you again, Jessica, for sitting down with me today. It's just been great chatting with you.
Thank you so much. It's been a real pleasure, and I'm so excited to present.
And as we are too here at goldperinatal.com, that's our website. So you need to go there right now and you can check out what's coming up. Our conference starts on October 2nd, and Jessica's actually going to be speaking on Monday, the 16th of October. However, check out our website for all the details for your particular time zone, because if you're in the Australias, it's going to be in a different time zone. So check out all of that and check out all of the other speakers that we have for this incredible conference for Gold Perinatal 2017. And again, for the website, it's goldperinatal.com. Thank you again, Jessica Tearne, for being with us today. And thank you to our listening audience. Bye-bye for now, everyone.